Sources. What's the funniest thing someone has said while high on anesthesia? Dorothy was 78, came in for a routine gallbladder surgery. Sharp as a tack, cracking jokes from the moment she rolled in. While I was hooking up her IV, she winked and said the heart monitor reminded her of that beeping sound from spy movies. I laughed it off, thinking she was just nervous. Once the anesthesia kicked in, most patients either go quiet or mumble nonsense. Not Dorothy. She started whispering about secret tunnels running under our hospital, claiming she could see them through the ceiling tiles. Then she said Dr. Williams would drop his scalpel in exactly 37 minutes because his left hand always twitches when he's tired. I checked the surgery schedule. Dr. Williams had been operating since 6 a.m. It was now 2 in the afternoon. Dorothy kept going, describing how the pharmacy was completely out of morphine, but still had 3 boxes hidden behind the outdated bandages on shelf 4. She mentioned seeing 2 security guards who weren't really security guards, and something about the janitor taking pictures of patient files when nobody was looking. The weirdest part? She knew the exact angle of every security camera in the operating room. She whispered about blind spots near the supply cabinets and which corners the cameras couldn't cover. I'd worked there for over a decade and never paid attention to camera placement. 36 minutes into surgery, Dr. Williams rubbed his left hand. 37 minutes in, his scalpel slipped right out of his grip and clattered to the floor. The whole surgical team froze. I felt my skin crawl. After surgery, Dorothy woke up completely normal, asking for ice chips and complaining about the hospital gown like every other patient. When I jokingly asked if she remembered talking about tunnels, she just smiled and said, "Anesthesia makes people say silly things." That evening, I decided to check her claims. I walked down to the pharmacy during my break, behind the outdated bandages on shelf 4, exactly where Dorothy said, 3 boxes of morphine. The night pharmacist looked confused when I asked about it, saying they'd been missing those boxes for weeks. 2 days later, I noticed our janitor, Eddie, acting strange. He'd been working here for months, but I realized I'd never actually seen him clean anything thoroughly. During his rounds, he spent way too much time near patient charts, always checking his phone, taking pictures of something. I started watching the security cameras more carefully. Dorothy was right about every single angle. There were blind spots exactly where she said, corners that couldn't be monitored. The supply cabinet she mentioned was completely hidden from camera view. The security guards she called fake? I looked them up in our employee directory. Neither of them existed in our system, but they'd been walking around for weeks wearing official badges, accessing restricted areas without anyone questioning them. I brought my concerns to hospital administration. They investigated and discovered Eddie wasn't actually employed by our cleaning service. The 2 fake security guards had been stealing patient information for identity theft. The missing morphine had been slowly disappearing for months. During the investigation, they found evidence of a small smuggling operation using maintenance tunnels that ran beneath the hospital, exactly like Dorothy described. Turns out our building was constructed over old subway maintenance shafts from the 1940s. Every single thing Dorothy mumbled while drugged out of her mind was completely accurate. She somehow observed patterns and details that trained security missed. The administration was so impressed they offered her a consulting job reviewing hospital security protocols. When I asked Dorothy how she knew all that stuff, she just winked and said 78 years of watching people teaches you things. Then she mentioned that the new night shift doctor has been stealing surgical supplies, and the head of cardiology is having an affair with the head of radiology in supply closet B. I checked the next week. She was right about both.